Hello.
I'm Dr. Kim, board-certified plastic surgeon at Human Plastic Surgery. Today, I'll be focusing on rhinoplasty cases that are considered the most technically challenging. We'll look at which cases are difficult, what the surgical key points are, and how we actually approach them step by step. The first extreme rhinoplasty case is thin skin. When the nasal skin is thin, we must operate very delicately during surgery to preserve it, as even minor trauma can affect the outcome. After surgery, once the swelling subsides, the underlying structures inevitably become more visible. If scarring occurs, it too becomes more noticeable, which adds difficulty to the surgical process and the aesthetic outcome. That's why techniques to reinforce or thicken the skin are sometimes necessary. These days, surgeons often use the patient's own tissue, from the buttocks, behind the ear, temporal fascia, or even rib cartilage, rather than artificial implants, which are used less frequently now. So what's most important in thin skin rhinoplasty? As I mentioned earlier, the structures beneath thin skin will always be more apparent. So the key is performing the surgery very carefully, avoiding trauma to the skin. Thorough bleeding control is essential to minimize scarring after surgery, and reinforcement with autologous, U-body's own tissue, helps strengthen the skin. Even with a technically successful surgery, if implants or cartilage shapes shine through too much, patients can become stressed. Therefore, in thin skin cases, the goal should be not excessive height or exaggeration, but a nose that harmonizes naturally with the patient's face, with elegant curves and balanced projection. The second extreme rhinoplasty case is the short, upturned nose. When the nose is lifted too much and the nostrils are overly exposed, it lacks refinement and overall makes the face appear less three-dimensional. In these cases, proper nasal length is critical. In the case of the first-time surgery, skin often doesn't stretch easily and cartilage is small. And in revision surgeries, where scarring or deformation from prior work makes it even harder to achieve sufficient extension, short noses are therefore often thought to have a high revision rate.
Is it true that short, upturned noses often need revision surgery?
Although it's true that short nose surgery is one of the common causes of revision surgery, but with today's advanced surgical techniques and accumulated experience, we can no longer say that surgery for a small, upturned nose always results in a higher rate of reoperation. One important thing is, in many recent difficult cases, rib cartilage or other foreign materials are used. But especially in revisions or complex cases, using the patient's own cartilage significantly reduces risks of infection or foreign body reaction and increases the chance of success. Asymmetrical nose. No human face is perfectly symmetrical. In some cases, previous surgeries that ignored existing asymmetry actually made it worse.
Can surgery fix it?
Yes, it can be corrected with surgery. However, the goal must always be harmony between the nose and the overall face. In cases of severe asymmetry, contouring or orthognathic surgery may be needed to achieve balance. The fourth extreme rhinoplasty case is the wide, thick-skin nose. There are three main variations. 1. The skin itself is thick. 2. The soft tissue beneath the skin is thick and bulky. 3. The tip cartilage is broad and splayed.
How do we correct a thick-skinned nose?
If the skin itself is thick, it's physically difficult to thin it down. In such cases, increasing nasal height can sometimes be the best solution.
Do we always need to reduce the nostrils in bulbous nose surgery?
Not necessarily. The proportion between the alar base and nasal tip is what really matters. A nose looks bulbous when the tip is disproportionately wide compared to the rest of the nose. If the alar base is overly reduced, the proportions break, and ironically, the tip can look even wider. So nostrils reduction is not always essential.
Among these four cases, which is the most difficult?
In my experience, thick-skinned bulbous noses are often the toughest. Many patients believe simply making the nose higher will help, but in reality, when the skin is thick and the nose is already high, sometimes lowering it while reshaping is necessary. Reducing skin thickness, trimming cartilage, and lowering nasal height all at once makes the surgery technically demanding, especially when excess skin remains. Today we've reviewed several of the most extreme and challenging rhinoplasty cases. The more complex the surgery, the more important it is to rely on solid fundamentals and judgment, rather than flashy design. If you're considering surgery, I hope you think not only about how beautiful the change might be, but also about how to achieve it safely. I'm Dr. Kim Gu-kyun, plastic surgeon at Human Plastic Surgery. Thank you.